Good morning. Firstly, I would like to thank the organizer of this meeting for their invitation and all the colleagues that are connected for their attention. Now we are going to talk about flexible ureteroscopy in patients with renal abnormalities. Since its first use, flexible ureteroscope are increasing their popularity due to constantly technological improvements. Currently, the European Guidelines of Urology recommends flexible ureteroscopy as first or second line therapy for almost all kidney stones, according to the stone burden and the localization of this stone. That's why more than 30% of currently kidney stone surgeries are performed with flexible scopes. But furthermore, there is an increase of use of those instruments for the diagnosis and the treatment of upper urothelial carcinoma. So the number of procedures and indication of use are increasing constantly. We can find different flexible scopes in the market. For practical reason, we can divide the flexible scopes in three groups: fiber optic flexible scopes, digital scopes, and single use, which can be said to be a concrete type of digital scope. The decision to use one modality of a scope or another should be held based on four different characteristics. There are some technical aspects we have to keep in mind in order to decide which flexible scope I am going to use for a concrete surgery. Firstly, quality of vision is better in those scopes with digital camera, but fiber optical scopes, on the other hand, are thinner. Usually, digital scopes diameter is bigger than HRR, and we can find in the market fiber optic scopes smaller than HRR. This smaller diameter provide better outflow of the irrigation with the same working channel. And this characteristic decrease intrarenal pressures in procedures when a small fiber optic scope is used. Also, the end-tip deflection has been shown to be better in flexible scopes. So according to those technical aspects, we will base the decision to use one type of scope or another for a concrete surgery. But also, this decision must be held according to the cost of the procedure. According to the literature, the costs associated to the flexible scope are related to the sterilization process, the storage, and the repair of the scopes after critical damages during surgeries. Challenging situations like the treatment of lower pole stones are known to be risky procedures, increasing the risk of scope damage due to the deflection need to arise the stone and the risk of damaging the working channel when introducing instruments through the scope in this position. So we can say that there is an increased risk of damaging the scope in procedures with increased angle of the ureter and when narrow ureters are present. And this is just, or we can say that it is just in cases of treating a patient with renal abnormalities, like congenital abnormalities or urinary diversions, in which we will find challenging situation, increasing the risk of damaging our scope and potentially increasing significantly the cost of the procedures. We have to, and also we have to keep in mind what we have said during the introduction of this talk. Nowadays, there is an increase in the number of flexible procedures in patients with upper urothelial carcinoma, and some of those patients will have a urinary diversion like ileal conducts or neobladder, which will increase the difficulty of these procedures and the risk of damaging the flexible scope. So when treating patients with renal abnormalities, we will face difficulties like urethral anastomosis with narrower urethral lumens and challenging insertion of this anastomosis in the neobladder or the ileal conduit. In addition, intrarenal pressure is even more important in those procedures due to the increased risk of sepsis in patients with urinary diversion and the potential risk of tumor seeding in fornix structures if it occurs when treating an upper urethral carcinoma. So single-use flexible scope will be an ideal scope when treating patients with renal abnormalities due to the increased risk of critical damage of the scope, but a smaller diameter will be disabled for increasing the urethral insertion ratio, which is known to be better in thinner scopes. And and also we need an improvement in the irrigation outflow, and it can be achieved with a reduction of the diameter of the scope, because it reduces intrarenal pressure, and as we have already said, it decreases the risk of sepsis and tumor seeding. And all this will be desirable to be with a better quality of vision using a digital camera. So the perfect flexible scope for treating those patients will be a single-use flexible scope with a small caliber. Now I am going to show you some clips of challenging situations we must face when treating patients with urinary diversion. In this first clip, we can see a favorable insertion of the left ureter in an ileal conduit, but a really narrow anastomosis of the right ureter, which requires a small caliber instruments. Here you see the left ureter anastomosis. In the second clip, a Wallace type reimplant is shown, and also the lumen of this anastomosis is wide enough. The insertion angle implied a correct entry of the ureteroscope. You can see the urethral lumen, but it is impossible to entry through the lumen. So a guide wire had to be used to overpass the anastomosis with the risk of damaging the scope with this maneuver. In this other case, we will see an ileal conduit with the insertion of the ureter more angled. The entry to the ureter was impossible due to this angle, so an anterograde guide wire was placed and removed with an itinol basket through the ileal conduit to be used for a retrograde insertion of the flexible scope. This is another maneuver that put in risk the flexible scope again, in order to be able to enter to the upper urinary system. That's the remove of the guide wire in order to be used to put the flexible scope in a retrograde direction. In this, this is another example of challenging urethral anastomosis due to the insertion, the angle of the insertion of the ureter in a patient with a neobladder. On the CT scan, we can see a suspicious lesion in the upper calyx. The left ureter anastomosis is situated in the anterior aspect of the neobladder, as you have already seen in the CT scan. And this localization make totally impossible the insertion of the flexible scope, and also make impossible the insertion of a straight or a curved guide wire through the ureter, as you will see. That's the straight guide wire, and it was impossible to place it through the ureter, and neither with the curved guide wire. So again, an anterograde guide wire was placed in order to be used to put the flexible scope in a retrograde manner. Yeah, you see the anterograde guide wire is removed through the urethra. And then we use this guide wire in order to push the flexible scope up to the upper urinary tract. Here we are. Finally, we will see an example of surgery in a congenital abnormality. In the CT scan, we can see a right cross renal ectopia and abnormal rotation of the left kidney. Upper urinary calyx stone was found in the left kidney with an unfavorable anatomy for percutaneous procedure. And due to the narrow lumen of the urethra that you will see, this is the urethral meatus, and the patient had a really narrow urethral lumen. So the fiber optic flexible scope was used. Also, all the stone was removed with the flexible scope, and it was quite comfortable because it was in the upper calyx. The complexity anatomy of the calyxial system put in risk of damaging the scope when checking the residual fragments in the whole collecting system. So a smaller diameters flexible single scope will be perfect for this procedure, but with the risk of damaging it due to this anatomy. So as a conclusion, the ideal flexible ureteroscope in challenging anatomies like renal abnormalities should be a small diameter scope to increase the insertion ratio and decrease the intrarenal pressure, with a standard working channel, with a digital camera and optimal irrigation in order to provide good quality of vision. And it should be a single-use flexible scope to avoid the increment of cost of the procedure due to the critical damage of the scope during those procedures. So thank you very much for your attention. And if you have any question, please let me know.
Yeah, thank you for your beautiful video. Even the sound was not all the time.
Sorry, because when
perfect,
we check it, okay. the audio was okay.
Yeah,
sorry.
Sure, but I think we were able to follow perfectly on your videos and the slides. It was okay. No worries. Just quick comment. I must say that when I discussed with my colleagues regarding the choice for single use, most of the people are very impressed by the quality of vision, and this is what we demonstrate easily to tell some people, look at my picture, this is a very good quality. And we must say that most of the time, the quality is okay. It's good, sometimes excellent, but this is not really the point. I think the most important recommendation we have to give to the colleagues is to look about the resistance of these single-use endoscope, because the problem is that when the people are using single-use, they are feeling that this is single-use, so they don't care so much when they are forcing scopes into the collecting system. When you are using reusable scope, you care about your scope because you know that if you force, you will break it, and then this is a disaster. But when people are using, I can see that when the people are using the single-use, they are really forcing much more. So I think this is also a general comment we need to tell the people. Yes, you can force, probably a little bit more, but don't force too much. Even I have no idea about what is too much. But I think that's something we need really to tell the colleagues. So my questions for you is regarding this new Pusen 7.5, because you already tested. So I would like to know from you, what is your experience regarding the resistance of these new scopes? Because it's much smaller, so maybe it's more fragile. So what is your experience?
Well, firstly, I would say that we have to be very gentle when we are performing a flexible ureteroscopy, not only for the scope, but also for the patient. Because if we make any movement with more strength or too hard, we can damage the urethra, and it will be a big problem. So it's not only for the scope, it's also for the patient. On the other hand, in the cases I have already performed with the new Pusen scope, I had the impression that it was as good as the previous version of this scope. It was thinner, but I didn't have the feeling that it could break more easily than the previous version or than a reusable scope. So in my opinions, you don't have to push, or you don't have to make different movements with a single use or a reusable in order to keep safe to give the safety for the patient. And concrete with this scope, I don't feel it's a soft or a weak instrument.
Okay, and just a very quick question. So if you have a case with renal abnormalities, in your practice, do you immediately select the single use, or do you still start to do it with the regular scope? And if you feel that it becomes more and more difficult, you stop and then you switch for the single use?
Usually, when you see a CT scan and you see the renal anatomy, you can almost think if it will be a challenging case or not. For example, the case I have shown of the patient with the neobladder, we were sure that it was going to be a challenging case. It was 6 months ago, so I didn't have this new Pusen flexible scope. I had to use my regular scope, my reusable scope. But for sure, nowadays I will use a single-use one with a small caliber in order to reduce the risk of breaking the scope, but also due to the caliber of this scope. Because with this new scope, we have the possibility to have a digital vision, a digital camera with a small diameter, which is really interesting for upper urothelial carcinoma.
I fully agree with you. I think now we can take the benefit of small size, digital view, and single use in case of any breakage. Thank you so much for your excellent presentation.